Labs aren't absolute in and of themselves. Like for instance, in traditional medicine, if a lab test like a TSH, a thyroid stimulating hormone, if your level of TSH is say 5, the cutoff criteria according to disease diagnosis and endocrinology is 4. So if you have a TSH, which is the thyroid feedback hormone at 5, often the endocrinologist will say to you, oh, let's just watch it. So a functional medicine doctor takes a whole list of symptoms and sees if that person is potentially hypothyroid, and then measures TSH, free T3, free T4, thyroid antibodies, thyroid peroxidase, reverse T3, and looks at the interplay of all of those parameters, looking at the clinical symptomatology, and then ascertains whether that patient's TSH should be lowered to less than 2.
Which you would not be able to do under the current paradigm of medicine in Canada.
If you lower TSHs below 2 or 1 under the current paradigm, I've acted as an expert witness for the college when they took a doctor to task for overprescribing thyroid medication, lowering the TSH to below 1, and they wanted me with my functional medicine training. This is when they thought I had some skill. Whether this doctor had overprescribed thyroid hormone according to the standard of care based on evidence-based medicine. Now, it subsequently turned out he had overprescribed, but I was able to quote the literature at length. I did an 18-page rebuttal, acted as an expert witness for the college, looking at this guy's prescribing habits, and said he was not wrong. He just should have followed up and done a repeat test sooner than he did, because he just let the test run and let the patient run, and the patient got thyrotoxic.
Oh, wow.
And then complained to the college that she was overdosed, which she was.
Yeah.
But there's a whole series of deductive reasonings and sort of algorithms that you've got to take into account. Now, if you've gone to an endocrinologist with a TSH of 5, they would say just watch, wait, and see.
Yeah. And so you can't run those like preventative tests without in Canada. You can't run all these other gamuts.
I have for 30 years, and now they say no more. Your ability to run functional labs to see if people are maximizing their biochemical potential, those days are over.